Hello everyone, it's Dr. Durst with RevitalyzeMD, and I want to talk to you today about the hottest treatment of 2021 and beyond. This one's not going anywhere, and it's just gotten more popular with time, and that's the Pdo Thread Lift. We're going to talk about the procedure, and we're going to walk through the entire procedure on me. And then that way you get the best of both worlds. You get me talking about the procedure, you get to see it with me having it done, and I can talk to you about what I was feeling during the time and what steps they were, and you can see it from beginning to end with my treatment. So don't forget to like and subscribe right now or at the end of the video, but also share with friends, and this is a great procedure to see. All right, so here we are at the beginning of the procedure. This is the actual thread placement, and on the right side of my face and over the nasolabial fold, because we always have problems with our nasolabial folds and we don't like them, and we want our cheeks to be lifted so that we have less prominence of our nasolabial folds. What happened prior to that's the thread. So threads, when we're doing lifting, are either a barbed thread or a molded thread, and this is a molded one. And so what happens is, right now that's the cannula, the thread's in it, so they advance the thread and then they pull out the cannula and the thread stays in place. And so those molds or barbs are going to lift the tissue, the subcutaneous tissue, and it's going to create a lift. And then likewise, it's also going to stimulate collagen elastin over time. So right here, we're going through the same entry point with a second thread that's going to go across the marionette line. And that's another area that we need to have lifted with time, because we get that jowling. And again, we lose support in our upper face, and so we start to get heavy in the lower face, and threads are an awesome opportunity to lift naturally. It doesn't impede movement, and it's very natural, and it gets better with time. So that thread stays in. Not only does it have a barb or a molded, part to it that's going to lift tissue, that's the immediate effect. So you do have an immediate effect, but then also it's going to stimulate collagen and elastin over time. So it's going to continue to improve. We did numb, and we have other videos that you can watch for the beginning of the procedure with marking and numbing the entry point. So right here, there's an entry point, and we mark based on that vectors of lift that we think are going to be the best for that patient. And then we, of course, have already cleansed the face, and we use antibacterial both cleanser, and then we also have a sterilizing prep that we do prior to making any entry into the skin. But we're going to numb that entry point that they're going through with some lidocaine, with that so that you get less bleeding. That epinephrine in it is going to minimize the bleeding, and that's the worst part of it. And it's the smallest insulin syringe you can get. And then we create the entry point, and then we're going to end up putting some numbing medicine through that tract and then the thread. So what you're seeing is the thread part of it. We do have other videos that show the numbing medicine and numbing the entry point, all of that. So right now, again, now we're going to the bottom part of my face. And so what this is I've been doing threads for years, and I wanted them done so badly, and my staff has assisted on tons of them, but we wanted to bring the trainer in because they come in from different areas of the country, so that they would also provide perspective on maybe how they're doing something different in different areas, or maybe some tips or tricks to it. And so my staff was actually performing it on me. And so again, it just shows you the trust that I have in these girls, because they're amazing and their skill level is amazing. But we do a lot of talking, so you can see I'm talking through most of it. It's very comfortable, not uncomfortable at all. And I talk and kind of, giving them perspective of how I'm feeling during the procedure. And I will say that, all you feel is a little kind of pulling. There was no pain at all. Now we're going into the neck, because again, we want to tighten up that jawline, right? So underneath, we're doing this thread that goes right underneath, and it's going to pull back, and it's going to better tighten and define the jawline. And again, none of this was uncomfortable. You know, they're going to engage the thread here, the thread stays in, and now you're going to end up seeing them lift a little bit and to cut the threads. And then we're going to move to the other side. And so I'm just giving them a little feedback. So right now they did do one entry point for 3 threads. I will say that people do them differently in different areas, and that's why I do like to have trainers come in and work with the staff. Is even though I might be doing something, I do it a specific way, but I want to see, has something changed, or are they doing it different in different areas? It's always nice to hear other professionals and how they may be doing it differently, and whether that's something I would like to add or not. I will say that this is the first time that we ever did the same entry point for threads. I've seen them where they use the same entry point and they tie it outside of and then tuck underneath, and I don't think that's a good idea, because it's not as sterile. So you shouldn't have it outside of and then let it go in. What we do is cut, and then what was already under the skin, we just basically bury a little bit more after, and you'll see us do that. But we never did go into the same entry point. We won't do that in the office going forward either, because I was a little tender for a couple days after just at the entry point, which I've never heard a patient complain of before. So, you know, if you just put a different entry point real close together, I think that's the best way to do it for patient comfort. It wasn't pain, it was just a little discomfort after, but I have never heard anyone complain of that. So I think just using different entry points solves that problem. So what they're going to do is just smooth it out, because the threads underneath, they lift a little bit before they cut, and so the skin looks a little wrinkled because it's basically folded over, and they got to smooth that out and hide the thread. And so the thread never is visibly out and then goes in. It's basically under and cut and then never comes out. So basically here it is. That's the cannula. So that cannula it's not a needle. You can see it's very blunt and has the thread in the cannula. And so that is a preloaded thread, and that's changed over time. Before, you'd have to put the thread in, but now they're preloaded. And so basically you're going to pull the cannula out and leave the thread, but you have to get into the position. And once you're into the position, I'll show you on the next one, at the very tip, at the end of the cannula, you're going to kind of press down, and they twist the cannula to engage the thread. And then right here, so watch this cannula. Again, if you're putting a couple different cannulas through that one hole, it just only makes sense that that's going to be a little sore after. So I think just going to, different entry point right real close is the best way to do it. So right now, they get it to the position that they want to stop, right? And you don't have to do the full thread. Like, the full thread doesn't need to be in a lifting thread. It does in a smoother twist, but basically you can see they get to that point and they press down and they twist it to engage, and they gauge it all the way out. You'll see it again here. So there's the cannula going down the track in the best vector of lift. They get to the bottom where they want to stop. They take that stopper out, advance the thread a little bit, press down and twist and engage, and then pull the thread out. And again, these girls are awesome. I trust them fully in doing all of these procedures even before we have a trainer come in, but it's always great for that trainer to watch them do it on me for the first time, because I already know they're ready to do it, and they're amazing, and I wanted it done so badly that this was an awesome opportunity for me to let the girls get some thread time, and for me to get this amazing procedure done on myself and have a trainer there to maybe give us a different perspective on this procedure. And again, this is a PDO thread lift. There's other types of threads. We only use the PDO threads, and the lifting thread is going to lift so you get an immediate effect, and then you get collagen elastin stimulation over time. So the effect just continues to get better and better with time. And so this is one of those natural looking procedures. It's regenerative. It stimulates collagen elastin. It creates a better lift, gets better with time, doesn't impede movement, is natural. It's addictive. Women love it. I love it. I want more. And so they just love threads. So again, I wanted to show you how comfortable it was. I was not uncomfortable at all. You've got to see right now where we did 6 threads on each side, and I wasn't in any discomfort. I was able to talk, give them feedback while they were doing it, and wasn't uncomfortable. And when they actually are cutting right here, they do get an additional lift too with it. So they can pull, get it, and again, this skin is kind of too tight right there, and that's meant to be that way until after they smooth it over. So then they smooth it, and look, no bruising, no swelling, looks natural. And now you're going to see some before and afters here shortly. And I was comfortable. Most people don't talk this much during, but again, I wanted to give them feedback and what I was feeling. We were talking about the procedure when we were doing it, and I guess I just never really shut up there, did I? I just kept talking. So now we're going to go through some before and afters. And so right now you'll see a before and after. And so we're going to do a frontal view first. When you look in the frontal, and sometimes it's a little more subtle with the frontal view. So you're going to want to look closely because we get a little heavy in the lower face as we age. So, you know, an inverted triangle is really the shape of youth. And then we have a regular triangle. So as we age, because our lower face gets heavier, we lose fat and bone in the upper face for structural support. And so our lower face fat pads tend to pronounce. And so right here, it's kind of subtle on the frontal sometimes. But again, this isn't a facelift. That's one of the downsides. If you want the lift of a facelift, you're going to have a lot more in the way of cost, and you're going to have some downtime, but you're still never going to get any regenerative effect with that. But here you can see my cheekbones are higher, and the nasolabial folds, you know, again, on that frontal view, sometimes you'll see it depends on whether you're smiling or not on a post, but the cheekbones, if you look at how flat my cheek looks on the left, and then how lifted the cheeks look on the right, the jawline is better defined on the right, not as squared off, more triangular. And then also my face just looks overall more thin. And this is right after, so you can see there's no swelling, there's no downtime. I look normal and natural after that, so you don't walk out. You can do it as a lunchtime procedure and have it done and not have any downtime. But right there, it's just an overall thinning and lifted face. And again, it's not surgical, so you're never going to get too much in the way of lift, and there's never such a thing as doing too many of them, because you can always do more over time, you know, close to the ones you had, or a little further out, because it does get better. And about 2 months is when we're usually doing some repeat post pictures to just make sure that, you know, everything looks good. If we wanted to touch up any, then we might put another thread on each side, and it just depends on the results and how happy people are with those initial threads. So now here we're looking at a side view. So this is basically a right side view, and you're going to look closely. Now this is impressive. So look right now at the jawline and how well defined the jawline is on the right. My neck looks so much bigger on the left, and post is thinned out. My jowling that I had on the left pre-picture is pronounced so much better, and just that thickness of the whole nasolabial fold jowl, and now how it's lifted, all of it's more defined. The cheekbone, the jawbone, the nasolabial fold, the jowling is better, and again, my face looks thinner, and so does my neck. And those are things you're going to see. And then on the other side, this would be a left side view. Again, you know, better defined jaw, no jowling, and a lifted cheekbone. My nasolabial fold looks better. And even on all of these, you look, and even the lips in the corner of the mouth looks elevated on all these all these post pictures. And then the final one is like a 45-degree, and again, just a lifted cheekbone, a really well-defined jawline. The jowling is almost gone, if not completely gone, and corner of the mouth looks elevated. You know, again, this isn't a perfect post. It's not in the exact same position, but again, amazing results. So this is a hot treatment. It's only going to get more popular. It's an amazing procedure. We do it on a daily basis. This combines well with lasers that are doing lifting. We have a 4D non-surgical facelift we'll do Morpheus or radiofrequency microneedling. You know, again, you need some filler for volume replacement, and then threads can pair along with this. So, you know, threads are amazing in and of them, like by themselves. In and of themselves, they're amazing. But to just make any procedure better, if you're kind of doing multiple different treatments to get the final result of an amazing and pronounced lift, that's probably the best way to do it. And you can do that over time. It doesn't all have to be done at the same time. So again, follow, like, subscribe, and hit that subscribe button and share it with friends. Leave some comments if there's any procedures that you've had done, threads that you've had done that you'd like to tell us about your experience. We would love to hear it. And again, just let us know what more you want to hear about and learn about, and we're willing to deep dive into anything aesthetics. And we're here to revitalize your look, your health, and your sex life. Thank you.